Have you ever felt an odd sensation in your body and wondered if it was something serious? Many people brush off symptoms, assuming they're just part of aging. But what if those small signals are actually your body's desperate plea for help? Today, we'll discuss 6 dangerous warning signs that doctors say should never be ignored, especially after the age of 60. These symptoms might seem harmless at first, but that they could indicate serious, even life-threatening conditions. More importantly, this video is not just about listing symptoms. It's about empowering you with knowledge, real-life stories, and practical advice so you can take control of your health. Stay with me until the end, because what you learn today might save your life or the life of someone you love. Before we begin, if you find this video helpful, please like, subscribe, and turn on notifications for more insights on senior health and well-being. Let's get started. Symptom number 1. Unexplained extreme fatigue. There's a big difference between feeling tired after a long day and experiencing a level of exhaustion that lingers for no apparent reason. Occasional tiredness is normal, especially after a lack of sleep, intense physical activity, or high-stress situations. However, extreme fatigue that persists for weeks, doesn't improve with rest, and interferes with daily life can indicate an underlying health issue. Fatigue is often overlooked because it's such a common complaint, but persistent, unexplained exhaustion can be an early warning sign of severe medical conditions. Some of the most concerning possibilities include heart disease. The heart pumps oxygen-rich blood to the body. If it's not functioning efficiently, such as in cases of heart failure or coronary artery disease, fatigue can set in as a result of reduced oxygen supply to the muscles and brain. Diabetes. High blood sugar levels can make the body's cells less efficient at using energy, leading to chronic exhaustion. Additionally, fluctuating blood sugar levels can cause energy crashes. Kidney disease. The kidneys filter waste from the blood. When they aren't working properly, toxins build up, leading to persistent fatigue. Anemia, common in kidney disease, can further contribute to feelings of exhaustion. Undiagnosed cancer. Certain cancers, especially leukemia, lymphoma, and colon cancer, can cause unexplained fatigue due to the body's immune system working overtime to fight abnormal cells. Chronic fatigue syndrome, CFS. This is a debilitating condition characterized by severe, long-lasting fatigue that doesn't improve with rest. Its exact cause is unknown, but it may be linked to viral infections or immune system dysfunction. Thyroid disorders. Both hypothyroidism, underactive thyroid, and hyperthyroidism, overactive thyroid, can lead to fatigue. The thyroid gland regulates metabolism, and any imbalance can disrupt energy levels. If you experience extreme fatigue that worsens over time, does not improve with rest, or prevents you from doing things you once enjoyed, it's essential to seek medical attention. Here's what you can do. Schedule a doctor's visit. Describe your symptoms in detail, including when the fatigue started, how long it lasts, and any other symptoms you've noticed. Keep a symptom diary. Track when fatigue hits, what makes it worse, and any patterns you notice. This can help your doctor diagnose the underlying issue more quickly. Get blood tests. Routine blood work can check for anemia, thyroid issues, infections, or other medical conditions contributing to fatigue. Evaluate your lifestyle. Poor sleep, dehydration, nutrient deficiencies such as iron or vitamin B12, and chronic stress can all contribute to fatigue. Making small changes like improving sleep hygiene, eating a balanced diet, and managing stress can help. Don't ignore other symptoms. If fatigue is accompanied by unexplained weight loss, shortness of breath, dizziness, or persistent pain, it's crucial to get checked immediately, as these could indicate a serious condition. Ignoring chronic fatigue can lead to worsening health problems. Taking it seriously and seeking medical advice can help identify potential health issues early and improve quality of life. Symptom number 2, sudden and severe chest pain. A crushing squeezing or intense pressure in your chest is one of the biggest red flags your body can give you. This symptom should never be ignored, as it often indicates a serious and potentially life-threatening medical condition. Severe chest pain is commonly associated with life-threatening conditions such as heart attacks, myocardial infarction, and aortic dissection. A heart attack occurs when blood flow to the heart is blocked, depriving the heart muscle of oxygen. Without prompt treatment, parts of the heart muscle begin to die, which can lead to permanent damage or even death. An aortic dissection is another deadly condition in which the inner layer of the aorta, the largest artery in the body, tears. This can cause severe internal bleeding and requires immediate surgery to prevent fatal consequences. Other conditions that can cause sudden chest pain include pulmonary embolism, where a blood clot blocks the arteries in the lungs, and pneumothorax, or collapsed lung. Ignoring chest pain or dismissing it as indigestion or muscle strain can be a fatal mistake. Many people delay seeking help because they believe the pain will go away, but time is critical in treating heart-related emergencies. The faster you seek medical attention, the better the chances of survival and recovery. If you experience sudden severe chest pain, especially if it feels like pressure, tightness, or squeezing, you must act immediately. Here's what you should do. Call emergency services immediately. Do not wait to see if the pain subsides. Dial emergency services such as 911 right away. Heart attacks and aortic dissections require urgent medical intervention. Chew aspirin, if recommended by your doctor. If you are at risk for heart disease and have been advised to take aspirin in an emergency, chew one, typically 325 milligrams, while waiting for help. Aspirin can help thin the blood and improve blood flow. Stay calm and rest. Try to remain as still and calm as possible. Avoid physical exertion as movement can worsen the condition. Sit or lie down in a comfortable position. Watch for additional symptoms. If your chest pain is accompanied by shortness of breath, nausea, sweating, dizziness, or pain spreading to your arms, jaw, or back, it is even more urgent to get medical help. These are classic heart attack symptoms. Do not drive yourself to the hospital. If possible, wait for emergency responders. Driving while having a heart attack or serious chest pain is extremely dangerous. Sudden and severe chest pain should never be ignored. Even if it turns out to be something less serious, getting checked by a medical professional is always the safest choice. Early intervention can save your life. Symptom number 3, difficulty breathing or shortness of breath. Imagine sitting in your favorite chair, calmly reading a book or watching television, when suddenly you feel like you can't catch your breath. Your chest tightens, and each inhale feels insufficient. You haven't been exerting yourself, yet it feels as though you've just run a marathon. This is a serious warning sign that should never be ignored. Unexplained shortness of breath isn't just uncomfortable, it can be life-threatening. It may indicate serious underlying conditions, including heart failure. When the heart is unable to pump blood efficiently, fluid can accumulate in the lungs, making it difficult to breathe. This type of shortness of breath is often worse when lying down and may be accompanied by swelling in the legs or extreme fatigue. Chronic obstructive pulmonary disease, COPD. Conditions such as emphysema and chronic bronchitis can progressively damage lung function, causing persistent breathlessness. Asthma. Sudden episodes of breathlessness may be triggered by allergens, exercise, or respiratory infections, leading to airway inflammation and narrowing. Pulmonary embolism. A blood clot in the lungs can block oxygen flow, leading to sudden and severe difficulty breathing. Other symptoms may include chest pain, rapid heart rate, and dizziness. This is a medical emergency that requires immediate intervention. Pneumonia or other respiratory infections. Shortness of breath can signal a lung infection, particularly in older adults or those with weakened immune systems. Fever, coughing, and chest pain may also be present. Additionally, shortness of breath can result from anxiety or panic attacks. But even in these cases, it's important to rule out physical causes before assuming it's purely psychological. If you experience sudden, severe, or unexplained difficulty breathing, do not ignore it. Here's what you should do. Seek immediate medical attention. Call 911 or go to the nearest emergency room if your breathlessness is sudden, severe, or accompanied by chest pain, dizziness, or confusion. Sit upright and try to stay calm. If lying down makes it worse, prop yourself up with pillows. Panicking can make breathing more difficult, so focus on slow, steady breaths. Use an inhaler if you have one. If you have a history of asthma or COPD and have been prescribed an inhaler, use it as directed. Avoid triggers. If you suspect an allergic reaction or an environmental factor like smoke or strong odors, move to fresh air immediately. Monitor your symptoms. Even if the breathlessness subsides, schedule a doctor's appointment to determine the underlying cause. Shortness of breath is not something to take lightly. It is your body's way of signaling that something may be wrong, and early detection can be life-saving. Symptom number 4, drastic and unexplained weight loss. Losing weight effortlessly might seem like a blessing at first glance, but when it happens unexpectedly and without any changes in diet or physical activity, it can be a serious red flag for underlying health issues. Many people associate weight loss with improved health, but when the body sheds pounds rapidly for no apparent reason, it could indicate a hidden medical condition requiring urgent attention. Significant and unexplained weight loss can be a sign of various serious health problems, including cancer. Many types of cancer, including pancreatic, lung, and stomach cancer, can cause sudden weight loss. This happens because cancer cells consume energy at a rapid rate, and tumors can affect metabolism, leading to muscle and fat loss. Metabolic disorders. Conditions such as hyperthyroidism, overactive thyroid, can accelerate metabolism, causing the body to burn calories much faster than usual. This results in unintended weight loss despite normal or increased food intake. Diabetes. Uncontrolled diabetes, especially type 1, can lead to sudden weight loss. When the body cannot properly use glucose for energy due to insulin issues, it starts breaking down fat and muscle for fuel. Heart failure. In advanced heart failure, the body struggles to maintain adequate circulation, leading to a condition called cardiac cachexia, where the body rapidly loses muscle and fat. Gastrointestinal diseases. Conditions like Crohn's disease, celiac disease, and peptic ulcers can interfere with nutrient absorption, leading to weight loss. Chronic infections. Serious infections such as tuberculosis or HIV/AIDS can lead to unintended weight loss due to the body's increased energy expenditure in fighting the disease. What you should do. If you have lost more than 5% of your body weight within 6 months without any clear reason, such as a change in diet or exercise, you should seek medical attention immediately. For example, if you weigh 150 pounds and lose more than 7 to 8 pounds without trying, it could be a cause for concern. Here are some important steps to take. Consult a doctor. A healthcare provider will assess your medical history, perform necessary tests, and determine if there is an underlying condition causing the weight loss. Monitor additional symptoms. Pay attention to other signs such as fatigue, loss of appetite, night sweats, or persistent digestive issues, which can help doctors diagnose the problem more accurately. Maintain a symptom journal. Keeping track of your weight fluctuations, eating habits, and any other unusual symptoms can provide valuable information for your doctor. Get blood tests and screenings. Depending on your medical history, your doctor may recommend blood tests, imaging scans, or biopsies to identify the cause. Unexplained weight loss is never something to ignore. While it might not always indicate a severe disease, it is a significant warning sign that your body needs medical evaluation. Catching potential health problems early can make a huge difference in treatment success and overall well-being. Symptom number 5, confusion, disorientation, or sudden personality changes. As we age, occasional forgetfulness, such as misplacing keys or struggling to recall a name, can be a normal part of life. However, experiencing sudden confusion, extreme disorientation, or noticeable personality shifts is not a typical sign of aging and should not be ignored. These changes may happen rapidly within hours or days and can indicate serious underlying health issues. Sudden cognitive decline or behavioral changes could be symptoms of several severe medical conditions. Stroke. A stroke occurs when blood flow to the brain is disrupted, depriving brain cells of oxygen. This can result in sudden confusion, difficulty speaking, loss of coordination, and abrupt personality shifts. Brain infection, encephalitis, or meningitis. Infections affecting the brain can cause swelling, leading to confusion, memory problems, difficulty concentrating, and altered behavior. Delirium. This is a sudden and severe change in mental function, often caused by infections, dehydration, or medication side effects. It can make a person feel disoriented, hallucinate, or have trouble recognizing familiar people and places. Early Alzheimer's disease or dementia. While mild memory loss is common in aging, sudden and significant confusion or personality changes could indicate the onset of neurodegenerative diseases. Early detection can help slow progression with proper medical interventions. Low blood sugar, hypoglycemia. In diabetics, a rapid drop in blood sugar can cause dizziness, confusion, slurred speech, and even aggressive behavior. Dehydration or nutritional deficiencies. Severe dehydration or a lack of essential vitamins, such as B12, can impair brain function and cause sudden cognitive changes. If you or a loved one suddenly experiences confusion, severe forgetfulness, disorientation, or noticeable personality changes, do not ignore it. Take the following steps. Seek immediate medical attention. Call emergency services if symptoms appear abruptly, as early intervention is critical for conditions like stroke or infections. Observe additional symptoms. Pay attention to accompanying signs like slurred speech, difficulty walking, fever, or loss of consciousness. Check blood sugar levels. If the individual has diabetes, test their blood sugar immediately to rule out hypoglycemia. Hydrate and ensure proper nutrition. If confusion is due to dehydration or a deficiency, restoring fluids and nutrients may help improve symptoms. Monitor medications. Some prescription drugs or drug interactions can lead to cognitive issues. Reviewing medications with a healthcare provider can help identify potential causes. Ignoring sudden cognitive changes can lead to severe consequences. Acting quickly can make a life-saving difference, especially in conditions like stroke or infections. Symptom 6. Severe and persistent abdominal pain. A stomach ache might not seem like a big deal. After all, most people experience occasional digestive discomfort due to overeating, gas, or mild food poisoning. However, when abdominal pain is severe, persistent, and unexplained, it could be a sign of a serious or even life-threatening medical condition. Ignoring it or assuming it will go away on its own could lead to severe complications, some of which require immediate medical intervention. Severe and persistent abdominal pain can be a symptom of several critical conditions, including ruptured abdominal aortic aneurysm, CHULA. This occurs when the large blood vessel that supplies blood to the abdomen, pelvis, and legs bulges and bursts. A ruptured aneurysm causes sudden, intense abdominal or back pain and is a medical emergency that requires immediate surgery. If untreated, it can lead to fatal internal bleeding. Intestinal blockage. A bowel obstruction prevents food and fluids from passing through the intestines. Symptoms often include severe cramping, bloating, nausea, and vomiting. If left untreated, it can lead to tissue death in the intestines, infection, or even perforation, which could be life-threatening. Pancreatitis. Inflammation of the pancreas can cause intense radiating pain that worsens after eating. It may also be accompanied by fever, nausea, vomiting, and rapid heartbeat. Severe cases can lead to complications such as organ failure. Gallbladder issues. Conditions like gallstones or cholecystitis, gallbladder inflammation, can cause severe pain in the upper right abdomen. If the bile ducts become blocked, infection and complications like sepsis can develop. Peritonitis. This is an infection of the peritoneum, the lining of the abdominal cavity, often caused by a ruptured appendix, perforated ulcer, or diverticulitis. It leads to severe pain, fever, and a rigid, swollen abdomen, and requires immediate surgical intervention. If you experience severe and persistent abdominal pain, do not ignore it, especially if it is accompanied by vomiting, nausea, or an inability to keep food down, fever, chills, or signs of infection, swelling, tenderness, or a rigid abdomen, dizziness, weakness, or fainting, sudden and severe pain that worsens over time. When to seek emergency medical care, call 911 or go to the emergency room immediately if your abdominal pain is sharp and sudden, especially if it radiates to the back or shoulders, potential signs of a ruptured aneurysm or perforated organ, severe and unrelenting, preventing normal activities or worsening over time, accompanied by bloody stools, vomiting blood, or black tarry stools, which could indicate internal bleeding. Abdominal pain that persists for more than a few hours, even if it is not extreme, should still be evaluated by a doctor to rule out any serious conditions. Early diagnosis and treatment can prevent complications and, in some cases, save your life. Your body speaks to you through symptoms, subtle messages that indicate when something is wrong. Ignoring these warning signs can be a fatal mistake. But recognizing them early gives you the power to take control of your health. The more you understand your body, the better equipped you are to prevent serious conditions before they become life threatening. Prioritizing your well being is not just about treating illness, it's about taking proactive steps every day. Healthy habits, regular checkups, and staying informed about potential risks can make all the difference. If you or a loved one has experienced any of these warning signs, don't wait. Consult a healthcare professional as soon as possible. Early detection can save lives. Remember, health is a lifelong journey, and knowledge is your greatest defense. The more you learn, the more empowered you become to make the right choices for your body and mind. If you found this information helpful, please like, subscribe, and share your thoughts in the comments. Have you or someone you know experienced these symptoms? What steps did you take? Your experiences can help others on their journey to better health. Stay informed, stay proactive, and we'll see you in the next video.